your questionnaire that we went through, I'm gonna have to do a cardiovascular and lung exam on you, okay? So I'm gonna start with the inspection of your chest, and then I'll do palpation, then I'll do percussion, and then listen to you. So I'll do your lungs anteriorly, and then I'll do them laterally and posteriorly. And then we'll do your cardiovascular and peripheral vascular, okay? Okay. All right, so I'm just going to look at you. So I'm actually move your hands out for my anterior view. And then I'm gonna adjust you again for the posterior, okay? So your face appears to be relaxed. That indicates that you're breathing unconsciously, which is benign, which is a good thing. Your brain's doing what it's supposed to do. You're alert and cooperative. Your lips appear to be without cyanosis or pallor. Let me see your hands. Okay, I see no clubbing of your fingers. Your circulation is intact. There's no cyanosis or pallor there. And then your nails are configured properly. Your respiratory rate is even in terms of your rhythm. I'm going to write what your respiratory rate is in my documentation. You don't appear to be using pursed lip breathing. You're not using any accessory muscles to breathe with. There's no retractions noted. And you don't have any nostril flaring as well. I hear no audible noises when you're breathing, which is good. And then I'm going to listen to your lungs. For your interior chest shape, I don't see any bulges, depressions, or anything that's abnormal in your configuration. Can you sit up tall for me? Your ribs are at a downward angle. All right, I'm gonna put my hands here. You take a deep breath for me. All right, you're symmetrical in your breathing. So now I'm gonna do your tactile firmitis. So I'm gonna be placing my hands on your chest. I'm gonna start with here, and then I'll have you saying 99 each time I move, okay?
99, okay. 99, 99, 99.
Okay, and then move on to your breast.
99, 99.
Okay. The vibrations are even and symmetrical all throughout the chest. Now I'm going to palpate and let me know if you feel any tenderness throughout your chest, okay? I'm going to start up here. I know, it's awkward, I'm sorry. That is so weird. Okay, any tenderness or anything? Okay, perfect. I still felt no bulges or depressions, which is good. Assess your skin trigger. So basically what I'm gonna do is I'm gonna pinch the skin on your chest, okay? So basically that shows no tenting, if like flat right back, which is good. Your circulation's intact. And your skin is warm and dry. I'm gonna percuss your lung fields anteriorly. So basically I'm gonna put my hand on your chest and I'm gonna tap my hand. And then that's going to assess the type of sounds, okay? More resonant sound. That was more of a flat sound. Okay, so this is more of a resonant sound up here. And then a dull sound over your heart. And a resonant sound. Lift up and under. You got more of a dull sound over your liver. More of a dull sound over there. Now I'm going to be doing your landmarks on your anterior chest, and then I'll be listening to your lungs from here. So this right here is your sternum. So this is your manubrium, sternal body. Right here's your xiphoid process, okay? And then when I was doing your breathing earlier, that's your costal angle. Your manubrium, where it separates from the body, is where your sternal angle is. Now I'm going to be listening to your lung sounds. So I'm actually going to start off up on your neck area. It's your bronchial sounds.
Breathe in and out of my other mouth.
Mouth. So deep breaths out of your mouth. So your bronchial sounds are loud. So your bronchial sounds are loud and high pitched and clear. And your bronchial vesicular sounds? These are more of a medium in quality compared to the bronchial sounds. And those are clear. And then your vesicular sounds. Actually, I'm gonna go back over here. Okay. The reason why I went back over there is because you have more of an expiratory wheeze up over here compared to your left side.
No bad thing.
It's just an abnormal finding. We'll talk about that. It's going to be something that you'd have to have a physical assessment with the doctor for. And then lift up with the rest. One more. Okay, and go to the side. Okay, and those are, your vesicular sounds are more of a low sound, and they're clear on the left side, and on the right side, like I said, you have more of an expiratory wheeze. Okay, now I'm going to be assessing your lateral chest, so I'm going to actually have you place your hands on your knees and lean forward a bit. So I'm going to look at your lateral chest on both sides. My back is to the camera. So I don't see any bulges, depressions, or pulsations. Is there any tenderness when I push? No. Okay, go on this side. You can see me doing things. Okay. Any tenderness? Okay. So on your both lateral sides, your skin is warm, intact, no appearance of cyanosis or pallor. So now I'm going to assess your posterior, so just keep your hands up like that, and I'm just going to inspect that first. So your skin appears to be intact other than a little bit of acne over here. It appears to be without cyanosis, there's no pallor, and your chest appears to be even. So I'm going to palpate. Your posterior chest also notes that you have your trapezius and your neck muscles are within normal limits for your age. Your scapula on both sides seem to be symmetrical, and I don't see any bulges, depressions, or pulsations. I'm going to palpate your chest, so that's going to be me touching you. So I'm going to find your C7, and then your T1. So your C7 is right here, and then your T1 is right here. So that actually starts me off for my landmark so I can listen to your chest appropriately. Okay, take a big breath for me. Okay, perfect. Your lungs appear to be symmetrical in terms of your ribcage expansion when you took a deep breath. Okay, now I'm gonna do the 99 thing again. This is your tactical firmitis. So when I place my hand up on your chest, I'm gonna have you say 99 each time I move, okay?
Okay.
Go ahead.
99, 99, 99, 99, 99, 99,
Sorry,
99,
couldn't feel it under you.
99,
Right, lost 2.
99, 99,
I lied, there's one more.
99.
Okay. So your vibrations were all even in quality, and they're all symmetrical. Now I'm gonna do the percussion on your back, just like I did on the anterior. So I'm gonna start up here and then work my way down through. So there's resonance up here. Now the flat sound over your scapula. Your resonance through your lung fields. Where your liver is more of a dull sound. More of a dull sound over your visceral area as well. Now to listen to your lung sounds. So again, with the C7 being right here and the T1 right here, this is a landmark for me to be able to assess where your lung sounds. Alright, so each time you feel my stethoscope, I'm going to have you take a deep breath, okay? sound. Nice and low and soft. It's more of a brachiovesicular sound right here. Again, with the brachiovesicular, moderate quality. Also brachiovesicular. Now one of the more of the vesicular lung sounds again. Soft and quality. And your lung sounds posteriorly are clear throughout. So now I'm going to be assessing for agophagy. So basically what I'm going to be doing is I'm going to be listening on your back with my stethoscope, and I'm going to have you make a long E sound, like E. And I'm going to be assessing to see if it keeps with the E sound or turns into an A sound. E. 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 Okay, so it remains a long E sound all throughout. I'm going to be assessing for bronchophony, so I'm going to be doing the same thing as I did with the E sound. I'm going to have you say 99.
Do I hold it?
99?
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so your voice was muffled, which is a good thing. Okay, so your voice was soft, muffled, and indistinct, which is within normal limits. Okay, so I'm going to be doing your cardiovascular system next. So that's going to be your heart and your peripheral to make sure that everything's working efficiently. So I'm going to actually start with your apical pulse, which is going to be over your chest. So I'm going to be doing your apical pulse. And I can't feel it while sitting up, so we're going to have you lay down and I'll turn your side once I'm going to listen to it first. I'm going to listen to your apical pulse. Okay, so your rhythm and rate is regular. Your rate was 62. So now I'm going to be palpating your carotid artery. So the good thing about the carotid artery is it provides blood to your brain, but I cannot palpate both of them at the same time. So I'm going to do one and then the other. Okay, so your carotid artery is smooth. I don't feel any bruit. And it's brisk in the upstroke and softer in the downstroke. Okay, now I'm going to do your other side. Okay, again, your carotid artery is smooth. I feel no bruit. And it's more brisk in the upstroke and slower in the downstroke. Now I'm going to be listening to your carotid arteries. So I'm going to start with this side again. I'm going to be listening in 3 different areas. I'm going to be assessing for thrill. So right here, no thrill.
Smell that thing.
It's a good thing. So next I'm going to palpate your apical pulse, which I can actually feel with you laying supine. That apparently is only true in about 25% of adults.
Wait, what?
You fancy. Typically you'd have to turn it on the side. Okay, I'm going to palpate your precordium now. I feel no pulsation. Okay, now I'm going to be listening to your heart. I'm going to be listening to your aorta. Okay, now your pulmonic artery. Your mitral valve. Now your tricuspid. Okay, now I'm going to be assessing your peripheral system. So I'm going to be looking for edema and I'll be feeling your pulses, okay? So I'm going to start with your arms. Can you actually take your bracelets off? Is that a chance?
The blue one, I can't.
That's fine. You don't have to take this one off either, just the hair ties. Okay, so now I'm going to be assessing your arms first. So I'm going to be doing your radial pulse. And they're the same rate and about +3 quality. They're the same rate and about +3 quality bilaterally. Okay, I feel no edema in this arm. And none in the upper extremity. So now I'm actually going to be doing the Allen's test. So what I'm going to be doing is occluding your arteries in both your radial and your ulnar. And then what's going to happen is the top of your hands should turn pale. And then I'm going to release your ulnar and the blood flow should return. Oliver Jace. You turned and was like, okay. So I'm going to occlude your hands. So I'm going to occlude your arteries and then release your ulnar and perfusion has returned.
I'm broken.
Okay, now I'm going to do the Allen's. Ollie, stop, baby. Justin, can you call the dog? No? Okay. You got it. Perfect. I'm going to do the Allen's test on this side as well. Your hand has gone pale. And blood flow has returned.
What if it didn't?
It didn't. I don't know if it just
Did it?
No.
Oh, that's cool.
Okay, now I'm going to assess for your brachial pulse. So your brachial pulse is right here. That's actually the pulse that we listen to when we take your blood pressure. Relax your arm down. Okay, they're both even in rate and rhythm. And +2 quality in both sides. Okay, so now I'm going to assess your popliteal pulses. So it's actually the pulses behind your knees. So there's one right here. And this one as well. I'm going to be doing your dorsalis pedis and your posterior tibial. So I'll do the posterior tibial first. It's actually going to be right here. And they're +2 quality as well, bilaterally. Then your dorsalis pedis. And those are +2 quality bilaterally.
Ow.
Oh, sorry, baby, I didn't.
It's okay.
Okay, edit that out.
So I'm going to be checking for edema, and I would like to note that your toes are cool to touch. And then I note no edema bilaterally in your legs. I'm going to check your feet. and no edema in either foot. Okay. Well, Ms. Haley, that completes my assessment of your cardiovascular and lung fields. Do you have any questions for me? Okay, at the end of this, what I would suggest is that because you have that expiratory wheeze on your right side, that you go get that checked out by a doctor, seeing as it is flu season, just to make sure. Okay?
Okay.
All right. Thank you.